so I'm knocking on the door. I'm washing my hands, providing patient privacy. I'm introducing myself to the patient. My name is Miles. I'm going to be your nurse for. I'm going to be your nurse for today.
Mm-hmm.
Can you please provide me your name and date of birth?
Daniela Hernandez, June 23rd, 1992.
All right, and what brings you in, Daniela?
I have really bad lower back pain lately.
Can you like describe that pain to me a little bit?
So it's like my lower back,
Mhm.
and it's just like a really painful throbbing.
And when did that start?
A couple days ago.
Do you remember what you were doing when that started?
I woke up and I felt it right away.
And where did you feel it? What was the location?
Like the absolute lowest part of my back.
Okay. And as far as like a duration goes, like is it more intermittent? Does it happen more often? Like
Well, since I've got it, it's more like intermittent.
okay, and what about like characteristics? Can you give me some characteristics of how you're feeling?
It's like a really deep, dull, like throbbing pain,
Mhm.
and then it like radiates down my left leg sometimes.
And what alleviates the pain?
Sometimes I'll ice it, or I'll take Tylenol if I'm
Okay.
feeling pain.
And I heard you said it radiates where exactly?
Down my leg past
Mhm.
my left knee.
Okay, and when it's at its worst, how long does it typically last?
Some days well, lately it's been lasting a couple hours.
Okay,
Yeah.
and as far as severity goes on a scale to from 0 to 10, with 0 being like it doesn't hurt at all, to 10 being super severe, it hurts, where would you say your pain is?
I would say probably like a 4.
Okay,
Yeah.
as far as like your past medical history, have you been hospitalized before or had any surgeries?
No.
And do you have any history of diabetes or like hypertension?
No.
No.
Mm-mm.
Okay, as far as like family history, is there any chronic illnesses that run in your family, like hypertension, diabetes, or even like cancer or anything like that?
Just high blood pressure, but that's it.
High blood pressure.
Mhm.
All right, and do you smoke, drink, use any type of substances?
I don't smoke. I don't do any kind of substances. I
Okay.
just drink socially.
Just drink socially.
Mhm.
And as far as like your stress, where would you say your stress is at?
It's pretty high. I'm
Pretty
pretty
high?
stressed. Yeah.
And why would you say that is?
I work pretty long hours.
And what do you do for your job?
I work at a hospital.
Hospital? And with you working at a hospital, like how's your diet?
It's all over the place. I can be either a vending machine or a full meal. It just depends on the day.
Okay, and do you take any like medications?
Nope, no medications.
Any type of like vitamins or supplements, anything like that?
Yes, I do take like a 20 milligram vitamin D every day.
Okay, and why is that?
Just deficient because I don't get outside very much.
I got you. And do you have any like allergies?
Allergies, just cats.
And what happens when you're exposed to a cat? Like, what's the reaction?
My throat gets really itchy. I can like swell up. My nose runs a lot.
Okay.
Yeah.
And are you up to date with your immunizations, like your flu and your COVID?
I do have my flu. I
Okay.
don't have my COVID.
No, you're good. All right, and we're just gonna run through like the body systems. Just let me know how you're feeling with each one. All right.
Okay.
As far as like your general health, do you have any like weight changes, or are you feeling any type of like fatigue?
No, no fatigue or weight change.
Okay, as far as like skin, are you noticing any like dryness or any type of like bumps or anything in any of your areas
No,
of your
everything's
body?
pretty
No?
smooth. Yeah.
As far as your head, is there any like dizziness, or are you feeling any type of like headaches?
No, just mostly the pain on my lower back.
Okay, and your respirations,
Mhm.
like do you have any like shortness of breath?
No,
No coughs or anything like
no
that?
coughing.
Okay. Now what about like your cardiovascular health? Like do you ever have any like chest palpitations or any chest pain at all?
No, no issues with my pain. Yeah, chest.
As far as using the bathroom, do you have any like constipation, any type of diarrhea, anything that's just making your stomach hurt overall?
No,
No?
no.
And what about like your any issues urinating?
No, no issues urinating.
Okay, anything with like a neuro, do you have any like numbness or tingling at all?
Sometimes it's just that numbness and tingling with my
Okay,
leg.
and that's
but
from the back
it.
pain?
Yeah, from the back pain, but that's
Okay.
it.
Alright, that's pretty much a wrap of our health assessment. Did you have any questions?
Okay. No, I think that's it, thank you.
Alright, thank you. You take care.
Nice.
That was